Order, order. Helen Morgan to move the motion.
Thank you very much, Sir Roger. It's a pleasure to serve with you in the chair today. I beg to move that this House has considered NHS readiness for winter 2024-25. I'm very grateful to have secured a crucial debate on the topic of preparing the NHS for winter, and particularly it's timely today on a day where the government's delivered the budget and outlined its priorities for the coming year and indeed the years after that. We all know that due to Conservative failure to protect the NHS, winter is a time where pressure on the NHS peaks, and every year we suffer something we describe as a winter crisis. But for the millions of people stuck on waiting lists, the thousands of people treated in corridors, and the legions of staff battling to keep people safe, it must feel like winter pressure never ends. I'm sure all of us would agree that the health and care crisis requires long-term action, improving public health, focusing on primary care, training and retaining more doctors, dentists and nurses, fixing the crumbling NHS estate, and fundamentally, finally addressing the crisis in social care. But while we wait for this action, winter now is looming. The clocks have gone back, and time to prepare for winter has run out. That's why I'm keen to hear both what the government is doing to get the NHS through the upcoming winter and, following the statement today, what the government is doing to get the NHS ready for the winters to come. Now, I'm aware that the Chancellor has just announced a 22 billion cash injection into the NHS, although further detail on that was scant. So we'll put forward our ideas in this debate and hope that they come to fruition over the next few weeks. For the sake of staff and patients, it's crucial that winter crises become a thing of the past. We've reached the point where winter pressure is normal all year round, and we should be striving for the reverse, where pressure is relieved and the forecasted crisis doesn't happen. So I'm pleased to hear some of the measures outlined by the government today, but I remain worried that fundamental issues are still being ignored, most crucially, the crisis in social care. And until this is resolved, we won't be able to fix the NHS. So what's the state of play? Dr John Dean, who's the Clinical Vice President of the Royal College of Physicians, has warned that the latest NHS statistics show the health service is in an extremely concerning position as we head into winter. And he's not alone in holding these concerns, for it's already been a really busy year for the NHS. In fact, it has been the busiest ever summer for A&E departments in England, with NHS staff managing 6.8 million attendances in just the last 3 months, according to the NHS England Readiness for Winter briefing. Last month, there were 2.2 million attendances to emergency departments, the highest number of attendances for a September on record, with over 38,000 people waiting longer than 12 hours after the decision to admit them. Meanwhile, the weekly average of extra bed days for patients remaining in hospital beyond 7 days due to delays in discharge was the highest since December 2022. A look at my local hospital trust in Shropshire illustrates the situation very, very well. In Shropshire, at Shrewsbury and Telford Hospital Trust, our bed occupancy rate is constantly around the 95% mark. That's not unusual. It's become the norm at acute hospital trusts up and down the country. It's not just in winter, it happens all year round. Hospital staff are constantly having to juggle resources to try and secure people the care they need. As the wards fill up, A&E becomes crowded and care moves onto corridors. Every month, I'm contacted by constituents who are shocked by what they've encountered in the hospital. Being forced to wait for hours in pain, on plastic chairs, having their dignity taken away as they occupy a trolley in a corridor, in agony and in full view of the public. Many people remain unaware of how common this is until they find themselves or a loved one in that situation. The Dispatches documentary filmed at Shrewsbury and Telford Hospital Trust earlier this year really brought the reality home to the nation. The issues with hygiene and infection control were startling enough on their own, and I'm pleased to say the Trust is addressing those directly. But it was the human impact on the patients that was most stark. Scenes like where an elderly man was forced to urinate in a trolley on a corridor in full view of the staff, or a woman crying out in agony for hours, and staff being left in despair at this terrible situation they're trying to deal with. And this was not in the depths of winter, this was in April and May. Corridor care takes a toll on patients and takes a huge toll on the staff who are forced to attempt to cope. Yet the full scale and the impact of corridor care is unknown, with only patchy reporting on the level of care in temporary environments. So as we seek to better understand and better prepare for pressure in the winter and pressure all year round, will the government consider mandating the recording and publishing of the number of patients receiving care in temporary environments like corridors? Honesty and transparency is key if we're to properly prepare for the winters to come. Every month, more than 2,000 patients spent more than 12 hours in the A&E departments at Shrewsbury and Telford. And 1 in every 3 of the many ambulances arriving outside has to wait more than an hour to hand over their patient. And that isn't in winter, that's every month of the year. Since April, ambulances have lost around 15,000 hours waiting outside the 2 hospitals in Shropshire, with 1 poor patient stuck in an ambulance in Shrewsbury for 15.5 hours. As we've discussed many times before, this keeps ambulances off the road and has a knock-on effect on waiting times for help to arrive for people who might be in a life and death situation. Mm-hmm. It leads to situations like one in my constituency in April this year, where a carer was left performing CPR for 23 minutes alone while being told by the 999 call operator that no ambulance was available. Tragically, the victim died, and the carer who tried so hard to save her has been left traumatised, as I would imagine has the 999 call operator. Meanwhile, I mentioned in the chamber a couple of weeks ago, 11-year-old Charlotte in my constituency has an adrenal deficiency, which leads to her needing an urgent injection of hydrocortisone if she has some kind of trauma. When it happens, she is logged as needing an automatic Category 1 ambulance response. A recent car crash happened, and Charlotte and her mother, when the service called for an ambulance, they were told that no one was available, and her family had to make their own way to hospital. And this isn't good enough, and it is endangering lives. The target for a Category 1 response time is an average of 7 minutes. So far this year in Shropshire, it's been 11 minutes and 57 seconds, while for a Category 3, which is still, for someone who urgently needs an ambulance, the average wait is more than 2 hours and more than double the target time. It isn't new, but it's very wrong, and it demonstrates the pressure already facing the health service as we head into winter. And perhaps more worryingly, the situation in many areas over this summer has been getting worse rather than better. West Midlands Ambulance Service, which serves my constituency, described a significant rapid deterioration of delays at hospital in September, which has continued further into October. This is a service which is already operating at the highest level risk score for the past year. October is forecast to be the second worst month on record for lost handover hours, with the equivalent of 130 ambulance crews in the West Midlands out of the 600 in the West Midlands being lost to delays every single day. And this is only October. It takes a huge toll on the mental health of the hard-working staff involved at every level. And crucially, it undermines the staff retention that will be so crucial for any NHS plan, the 10-year plan or any winter plan to come. Because we must retain these experienced professionals. We can't rely on recruitment alone to solve our staffing crisis in the NHS. These wonderful staff have been stretched to breaking point by years of neglect and mismanagement by the Conservatives, and Labour must do better than they have. But both patients and staff are understandably fearful as we approach winter. According to a recent poll commissioned by Liberal Democrats, 1 in 4 people in Britain have avoided calling an ambulance because they're frightened it will take too long to arrive. And of course, many pensioners are particularly fearful this year. Winter is a perilous time for older people with the additional diseases that they might catch, and many of them will be more at risk after being denied the winter fuel payment for the first time. This will be the first winter without the payment being universal, and the annual uprating of the state pension won't make up the shortfall until next spring, which is too late to pay your electricity bill or gas bill. And in my constituency, if you have to top your oil tank up now, it's too late for that too. So there's a danger, as happened when fuel costs increased 2 years ago, that people will reduce or turn off their heating entirely, with possible consequences for their health and a knock-on effect for the NHS. So what are the solutions? Firstly, we need to stop throwing money at the fire and instead prepare properly. The most cost-effective cure, as we all know, is prevention in the first place. Over the past 7 years, the Conservative government announced an average of £376 million of emergency funding each year to tackle the winter crisis, much of which arrived too late to have any meaningful difference. What Liberal Democrats want to do is create a winter task force armed with a ring-fence fund of £1.5 billion for the next 4 years. This would be used to build resilience in hospitals, A&E departments, ambulance services and the discharge of patients, and allow integrated care boards and NHS trusts that are struggling to balance their books to plan their budget more effectively in advance to cope with the winter crisis. The task force will bring together senior leaders from the NHS and the government, together with staff representatives, to ensure better coordination and preparation for winter. They would be empowered to deliver rapid changes in day-to-day operations to ensure a coordinated response, for example, by deploying more beds to certain hospitals or boosting social care capacity where it's most needed. Because tackling the issue of patient flow, it is most fundamental for steering our health system through this winter and the years ahead. If patients are to be treated on time, they need their ambulance to arrive on time. That ambulance must be able to hand over its patient to A&E as soon as it gets there. And if A&E is to have more capacity, we need to reduce the amount of people there in the first place through prevention and investment in primary care. Yeah. And we must make hospital beds available so that patients can be moved out of the A&E department and into the medical or surgical part of the hospital as appropriate. And if we are to move them on when they are ready to go home, when they would be better served in their own home with the proper therapy by investing in social care and dealing with the capacity issue in social care, which is at the heart of so many of these problems. 500,000 people in England are waiting for care, stranded in hospital beds that are so important to free up over winter. And social care has been continually ignored for many years by those in power. And I'm extremely worried that the government today hasn't really said an awful lot about social care in the budget. The additional money announced for local councils today, of which 600 million is for social care, presumably will be largely gobbled up by the increase in national insurance contributions and the minimum wage. And that's really concerning, that those councils won't be able to meet their social care commitments in the future. We urgently need cross-party talks so that we can commit between us to a long-term solution to the crisis that is social care. Liberal Democrats believe we should introduce free personal care along the lines of the model in Scotland. This would help people to stay in their own homes, stay out of hospital and ease the pressure on the NHS. And it should be paid for a fairer deal for unpaid carers and a higher carers minimum wage, which of course we saw some movements towards in today's budget and which we welcome and very much look forward to the review of the cliff edge in the carers in the unpaid carers allowance. But critically, a higher carers minimum wage must be fully funded because councils will be pushed over the edge if they aren't given the money to support that, as will many small care providers who provide the vast majority of paid social care in this country. We need to make sure people can see a GP when they need one, so they don't end up adding to the overwhelming pressure on A&E departments. I recently spoke to someone who waited 7 weeks for a telephone consultation in my constituency. We must ensure that what we're focusing on is the outcome for the patient, and that's why we would give everyone the right to see a GP within 7 days or 24 hours if the need was urgent. And we need to increase the GP workforce by 8,000 at least to deliver that. And as I said at the beginning, crucially by retention as well as by recruitment and more training. We also need to reform the NHS dental contract and guarantee access to an NHS dentist for anyone needing urgent or emergency dental care, ending the dental deserts that exist both in my constituency in North Shropshire and the rest of the country. The biggest reason for a child to go into hospital is to have a tooth extraction because their teeth are in such a poor state. That's scandalous, and I am very much looking forward to hearing what the government are going to do to address that issue. We also need to support community pharmacists. They're critical to the preparedness of the NHS by making sure that everyone has access to the healthcare advice and medicines they need. Pharmacy First is an excellent idea and helps to relieve the pressure on the NHS, but community pharmacists are closing at an alarming rate, and we risk that good idea going to waste. Are enough people being vaccinated against the triple-demic of flu, COVID and RSV, and that includes staff? Analysis by the Health Service Journal showed 283,000 fewer staff received a flu jab last winter than the end of 2019, despite the number of frontline staff growing. If staff aren't protected, then fewer patients will be protected when they get more seriously ill, and staff won't be able to go to work to treat the ill people when they get there. Increasing awareness of what's on offer at pharmacies, reversing cuts to the public health grant to increase the health and fitness of people up and down the country is integral for relieving pressure on hospitals and preparing the NHS for winters to come. So in conclusion, Sir Roger, stories and statistics from up and down the country show that the NHS is already this summer under extremely severe pressure. This has been the case all the way through this year and last year. It's autumn now, and it's critical that the government outlines its plans to deal with the added pressure of this winter to come. But more fundamentally, we need to see bold long-term action so that winter crises become a thing of the past. We need to train, recruit and retain and make staff proud and happy instead of making them tired and stressed and leaving the system. We need to fix our crumbling hospitals so that money can be spent on care instead of fighting fires and draining floods. We need to invest in all aspects of primary care, from dentists to doctors to pharmacists, and as I reminded in the chamber last week, optometrists as well. And most crucially of all, we must confront the crisis in social care. Earlier this week, the Secretary of State said the budget will arrest the decline in the NHS, and I'm afraid that's not good enough. The annual winter crisis costs lives, it costs jobs, and it costs patient dignity, and it costs the taxpayer more than we can afford. We must invest now. We cannot afford not to do it. We must invest to save so that we have an NHS fit to the future. Thank you.
The question is that this House has considered NHS readiness for winter 2024-25. Jess Brown-Fuller.
Thank you, Sir Roger. It's a pleasure to serve under your chairmanship. And I'd like to thank the Honourable Friend for North Shropshire for bringing forward this really important debate today on a very busy day for all of the members with the budget announcements in the chamber. Last winter was nothing short of a catastrophe for the NHS and everyone who depended on it. Between November 2023 and March 2024, NHS figures show that nearly 750,000 endured A&E waits of over 4 hours to be admitted, and nearly 250,000 waited more than 12 hours. In West Sussex alone, there have been 25,000 cases of 12-hour A&E waits so far this year, which is a 36% increase compared to the same period last year. These figures leave patients and staff in my constituency of Chichester deeply anxious as we approach another winter, especially following the busiest summer on record, with NHS staff managing a staggering 6.8 million attendances over just 3 months. In many cases, being seen quickly is literally a matter of life or death, especially in acute and emergency settings. And Rory Dayton, the director of the NHS Confederation's Acute Network, has warned us that without immediate funding, there is a very real risk the NHS falls into crisis this winter, with ambulance response and handover delays, overcrowded A&Es, and people stuck in hospital beds due to a lack of community and social care. It is evident that many of my constituents in Chichester have lost faith in emergency health services, shown in a recent poll conducted by the Liberal Democrats that showed 1 in 4 Britons have avoided calling an ambulance for fear it would just take too long to arrive. NHS paramedics, nurses and doctors consistently go above and beyond, yet the system that they are working in has stretched them to breaking point. Patients are bearing the consequences, suffering each winter as the NHS crisis intensifies. And today's budget announcement from the Chancellor to introduce a 10-year plan in the spring will not address the immediate crisis that is on our doorsteps. And it was very disappointing to hear that very little attention was paid to social care, which we know contributes to a huge number of beds being used in hospitals. You can't fix the bed crisis by just buying more beds. You need to invest in the workforce to support those beds and avoid a winter of my constituents in Chichester sleeping in corridors or waiting in comfortable waiting rooms, an experience that was all too familiar for me last winter when my grandmother ended up in a corridor where she was admitted in agony, in full view of the public. An incredibly distressing experience for anybody, let alone somebody suffering with acute dementia. There is no point throwing money at a leaky bucket if the funding isn't going to get where it needs to go to address the issues across the healthcare system. In my role as the Liberal Democrat spokesperson for hospitals and primary care, I have had the opportunity to meet with professionals across primary and secondary care and hear what they are calling for to be able to successfully provide a service this winter and across the board. They are asking to be able to plan with budgets that have a longer shelf life than 12 months and allow them to innovate for the future. Year after year, the previous Conservative government resorted to spending hundreds of millions of pounds in emergency funds every year to manage the winter crisis. This emergency funding was a short-term fix, and it often arrived in those hospitals far too late to address the problem, as the Honourable Member for North Shropshire pointed out in her opening remarks. It was a short-term fix rather than a comprehensive long-term plan to invest ahead of the crisis. So the Liberal Democrats have long called for a winter task force to oversee a dedicated ring-fenced fund to build resilience for the hospital wards, A&E departments, ambulance services and patient discharge pathways over the next 4 years. I have no doubt this won't be the last time that we talk about the NHS preparedness for winter, and I fear that the budget today will not have alleviated the concerns and fears of my Chichester constituents, nor the staff working in healthcare in my area had before today. So I urge the government to use our ideas, prepare our NHS not just for this winter, but for future winters, and we are ready to work constructively with the government to do so. Thank you. Sir Roger.
Sorry, I'm just tuning to speak, Sir Roger, my apologies. Can I just say what a pleasure it is to speak in this debate. Can I first of all congratulate the Honourable Lady for North Shropshire for setting the scene so very well. Today we've had some good news in the Chamber, and the good news is there's going to be some, I think it's £22 billion to be spent in the NHS, so much per day. And the good news for us, Sir Roger, is that through the Barnett Consequential, some of that will come to Northern Ireland. We don't know yet what the quantity will be, but we're pretty sure that some of it will come. So I'm the DUP party's health spokesperson. So I join in colleagues, with colleagues expressing concerns for my constituents and their access to good health care this winter. Everyone has spoken about that, and we can't ignore the issue. But we do hope that what government has put forward today as a helpful financial solution will go some way to try and address the issue. I'm aware that this is a devolved matter, but funding is not devolved, and neither is the obligation on government to implement their promised NHS reform throughout the entire UK. I know my questions to the Health Secretary of State, I asked him that very question, and he was very clear in his commitment that he will see that everyone in the United Kingdom of Great Britain and Northern Ireland will see the benefits. So hopefully today is a step in that right direction. The Department for Health has released their winter preparedness document for last year, and I welcome some of the emphasis, such as strengthening the urgent and emergency care system to provide alternatives to emergency departments, including urgent care centres, urgent streaming services, rapid access clinics and the local phone first services. Just the other day there, the Honourable Lady from Shropshire, North Shropshire, who set the scene, referred to ophthalmology, and I think it is important that we have that included in, and so we'll ask some questions along them lines. There was an event yesterday, the Eyes Have It. Again, as a party health spokesperson, I try to go to as many of these health things here that are in the House of Commons premises. And they had outlined a number of things that they wish to see as well. So perhaps, Minister, you might give us some ideas how we can improve the ophthalmology across the United Kingdom. I first of all welcome the 3.4 million in funding provided to general medical services and out of our services, the OOH, to support GP practices, increase their capacity in light of the anticipated increase in demand over the winter. 4.3 million provided to support GP practices across Northern Ireland to provide proactive support and care to those in nursing and residential care homes. Again, an example of what can be done. And I'm going to mention some of the other things that they're doing as well, because they really are quite positive. And I'm very hopeful, Sir Roger, that through the extra money allocated to the NHS today by the Chancellor, that some of that will filter its way towards Northern Ireland. Northern Ireland Ambulance Service, Honourable Lady from North Shropshire referred to the ambulance service as well. My ambulance service, Northern Ireland Ambulance Service, increasing the range and capacity of clinical expertise within the ambulance emergency control to help ensure that cases are appropriately managed and there isn't time delays. Enhanced hospital capacity with 45 beds open for last winter in the Ulster Hospital, my local hospital. And that will continue to be funded. These are some of the good stories, some of the good news. Rolling out the pharmacy first pilot service for uncomplicated urinary tract infection in women aged 16 to 64. This will expand the current pilot of 62 community pharmacies to the entire pharmacy network of some 500 pharmacies right across Northern Ireland, through an investment of some £410,000. Again, money is allocated in the right places to do the right job and hopefully make lives better. And over the winter period, it's estimated they will deliver 12,000 consultations, freeing up capacity in GP practices. The whole idea of doing the first pilot service pharmacy scheme was to release the pressures on the GPs, and I know the Minister has always been committed to that as well, and there are good things that can happen, and hopefully after today even more good things can happen when we look forward. Allocating some £265,000 to a new pharmacy first sore throat test and treat service, which has also been piloted this winter. Again, when winter comes, there's colds, there's flus, there's sore throats, there's days off, and everybody rushes to the GP. This will be a way of reducing the impact upon the GP. And again, I believe these are good schemes which can help the overall to the benefit of the NHS. This will be piloted in 40 pharmacies. It's estimated that through that some 8,000 consultations will be delivered this winter. Again, good news. All of these are welcomed, Sir Roger, but none brought the result of an NHS that was prepared last winter. Indeed, this has increased my conviction that we are more in a more difficult situation this winter, and the pressure on the NHS cannot be relieved by these small measures. So I don't know, Minister, where you're able to give us some indication of how the monies that were announced by the Chancellor today will be allocated and how that will improve NHS response to the measures of this winter. We need GP practices that can refer their patients to get an MRI, knowing they will be seen in a reasonable time, rather than making the referral and then telling the patient to go and spend the day in A&E to get the MRI. These are small things, but they're significant things that make a difference and can improve the service overall. GPs do not trust the red flag system, and that's what they tell me, and therefore A&E is turning it into that red flag for test system. So how can you really blame the GP for trying to ensure that they don't miss anything and using the system in that way? We need more capacity for MRI, for CAT scans, for mammograms. We need more trained radiographers. I think one of the things that was announced today was an investment, a very significant investment, I understand, in radiography. But when it comes to allocating of funds for radiography, we also need to have very clearly make sure that radiographers are recruited and retained. And as perhaps the Minister, again, I'm sorry to ask these questions and may not have the knowledge of the answers, but is there any indication of what's been done to train more radiographers and improve our NHS as well? As a result of that, some 188,881 people in Northern Ireland, nearly 10% of the population, are now waiting for a diagnostic test. This wait means that treatment such as radiotherapy is delayed. Cases become much more complex by the time delays. It's a nature of, if you've got a problem, a health problem, get it seen early and respond early. And the wait means that treatment such as, and for some patients even a 2-week delay can make the difference between life and death. This is a long-term issue that needs a long-term vision, and that's why I'm asking the Minister to take seriously the schemes that would encourage some of our very intelligent and capable young people to train here. I've been a great advocate of this the whole way through the system, Sir Roger. I've asked this question numerous occasions to the Health Service over the years. We want our intelligent and young, capable people to train here and stay here with those skills. Then university bursaries or forgiveness of student debt in return for a period of employment in the NHS would be a really, really positive way forward. Again, Minister, if it's possible to look at that as well and to ensure that the young people we have here who go into debt very early on and find themselves perhaps that debt will hang around their shoulders and their necks for many years to come, if we can offer them a job in the NHS and they give a commitment to retain, then we can improve things. and we have incredibly capable, intelligent British students. We need to invest in them and their long-term career in the NHS, to work alongside junior doctors and start preparing them for the marathon of NHS life rather than the sprints which they cannot sustain. If we can get the system moving in that direction, then I believe that there is work to do, not simply for this winter, but for every day of the winters yet to come. Thanks so much.
Steph Ackeren.
Thank you, Sir Roger. It's a pleasure to serve under your experienced chairmanship, and may I congratulate my honourable friend from North Shropshire on securing this vitally important debate. Our rural constituencies share many similarities, and I know that the NHS winter crisis will be as great a source of concern for her constituents as it is for mine. She may or may not have also noticed that she was speaking at the same time as Liberal Democrat leader Ed Davey was in the House, and I'm grateful, therefore, to the Minister for attending here on a day and at a precise time that her colleague is responding to his questions there. It couldn't be more timely that we're talking about this, given the context of today's budget, but also the winter that we're rapidly heading into. And as I hope many members will know, North Norfolk is proudly the constituency with the oldest demographic in the country. But this does mean that when our NHS struggles, North Norfolk is acutely vulnerable to its effects. I want to pay tribute at this point to much of the hard work that's already going on in Norfolk to prepare for winter in our health surgeries, our health services. Our GP surgeries and our community nurses are working day in, day out to deliver flu and COVID vaccinations for thousands of eligible residents. And I also want to use this opportunity to encourage anyone eligible who is yet to take up these free vaccinations to contact their GP and do so. This work is vital to building the resilience of our communities ahead of these cold winter months, and I know that local residents are incredibly grateful for that hard work. However, we are once again heading into a difficult winter. In my constituency, we have historically had some of the longest ambulance waiting times in the country. In towns and villages like Blakeney, Cley, Wells next to sea, people are subjected to appalling and unacceptable wait times for urgent calls. Nationwide, people are fearful of this crisis, with recent polling stating that 1 in 4 people have avoided calling an ambulance altogether because they're worried it would take too long to arrive. This situation cannot carry on. So, Roger, in order to ease the pressure on our hospitals this winter, we need people to be able to leave acute settings when they're able to, and need them to keep well enough to avoid going back in. And can I add to what my honourable friend has said about delayed discharges of care by saying that this is yet another reason why I find myself completely baffled by the decision of the Conservative-led Norfolk County Council to close the Benjamin Court Reablement Facility in Cromer. I should refer to my members of Register of Interest as a sitting Liberal Democrat member of that council. The Benjamin Court facility helps to bring people back into the community, enabling them to recover in a more familiar setting. We know that convalescence like this works. It reduces readmittance and enables people to spend greater time with their families as they're recovering. The Integrated Care Board for Norfolk and Waveney says they want to place a greater focus on recovery at home, and I appreciate that may work for some, but not for many. And I'm working alongside the Save Benjamin Court campaign to secure the future of this facility. I'd greatly appreciate it if the Minister could take time to meet with myself and representatives from that campaign to discuss why this vital service must be maintained. Winter also exacerbates one of the major challenges in North Norfolk when it comes to people accessing healthcare, and that is our inadequate rural public transport. Wintry conditions and car reliance do not mix well, Sir Roger, but that is the reality that will present to many if they have an early morning appointment at one of our hospitals. People are faced with multi-hour round trips when using rural buses and limited times when they could make an appointment, let alone the impact that any winter-led delays will have on their plans. In order to improve my constituents' access to healthcare, we must also improve their access to public transport. I'm, of course, fully supportive of the Liberal Democrat plan to winter-proof our NHS, and a winter task force with ring-fence funding will go a long way to building the resilience that we need in North Norfolk. We can't keep lurching from crisis to crisis each winter, stuck in one of the doom loops which the Chancellor spoke about before the budget. We need to see a change of approach, a funding settlement which is proactive, not reactive, and an NHS which is able to fully support people across North Norfolk all year round.
Richard Ford.
Thank you, Sir Roger, and it is an honour to serve under your chairship. And I too would like to pay tribute to the Honourable Member for North Shropshire on a day when, no doubt, she, as the Liberal Democrat Health spokesperson, has a lot else to do to secure and speak in this debate. As we face another winter, our NHS is under severe strain. And in East and Mid Devon, where I'm from, we know the situation is all too apparent. We've got 5 community hospitals across Axminster, Honiton, Seaton, Ottery St Mary and Sidmouth. And we see in those community hospitals really hard-working staff who are doing their absolute level best to deliver vital services like audiology, x-rays, rheumatology, a whole range of services. But these hospitals have been having their services reduced or even removed over time. And what this leads to is the overburdening then of the large acute hospitals. The unfortunate reality is that the NHS is really struggling in terms of acute hospitals like the RD&E in Exeter. The statistics in the southwest from last winter illustrate this very well. Across Devon, we saw 33% of patients in A&E waiting over 4 hours in February of last winter, which is well above the national average. And what this means is that ambulances, rather than being out in the streets and the lanes, saving people's lives, have been spending 30 minutes or more waiting in queues outside, with 31% of ambulance arrivals last winter at the RD&E unable to offload patients in a timely manner. That might suggest to some that we need somehow then to put more money into ambulances and acute care, but I think the research doesn't bear that out as the exclusive solution to the problem. A King's Fund report recently found that the failure to grow and invest in primary and community health and care services ranks as one of the most significant and long-running failures of policy in relation to health over the last 30 years. And today, we've heard from the government a budget that pledges more funding for the NHS, and we worry about what that might mean in the absence of support for social care. Because the system is reactive, we are spending increasing amounts on acute hospitals and crisis response rather than the kind of proactive primary and community care that could reduce hospital demand in the first place. This imbalance means that funding is being funneled into hospitals once people are very ill, and it's leaving those community services that could prevent crises from actually doing the preventative work that they should be doing. So our community hospitals in places like Mid and East Devon are proof that effective healthcare is not just about big hospitals. What I'd like to see instead is localised, specialised care that prevents and treats issues early, close to home. These community hospitals should offer more than just treatment. They're also about routine checkups and screenings, the sort of places that people could go for managing chronic conditions and other ongoing care. I really must stress that we have excellent healthcare staff in Devon, both in the community hospitals, in primary care, in GP surgeries, in the acute hospitals. But they are being asked to do more with less year after year. With more community-based teams working closely with social care providers, we could avoid many of those delayed discharges that we're seeing in the acute hospitals. Over 1 in 8 acute beds in England is essentially blocked, with 14,000 patients clogging the system. And I don't mean to put it in those terms. I know sometimes that individuals in that situation, filling an acute bed because they are unable to be discharged, sometimes feel like a burden. I don't want that to be the case. But the fact of the matter is, we are seeing acute beds that could be released for other needy patients. Winter brings respiratory infections, flu and RSV, all of which hit the elderly, the young, and those with long-term health conditions the hardest. Flu uptake, or rather flu vaccine uptake in the southwest, is not where it needs to be. It was only 46.5% last winter, and people with long-term conditions really, I should urge, to get vaccinated. When flu and other winter illnesses surge, it is the community health services and facilities that can pick up some of the slack and reduce some of the pressure on hospital beds. To draw my remarks to a close, Sir Roger, if we can shift a focus to community health, it's really about preparation. I know it's challenging. I know it must be challenging, or else we would have done it in the last 3 decades. But we need now a concerted effort to, from both national leaders and local leaders to support that shift and support people in managing their own health before they're in crisis so as to relieve pressure on the acute hospitals. Thank you.
Dr. Danny James.
Thank you for calling me to speak in this debate, Sir Roger, and thank you to my friend from North Shropshire for securing this very timely debate. Certainly in Winchester, and it'll be the same for the rest of the country, the NHS is the #1 issue for nearly everyone, and both patients and staff are aware that every winter we have this huge challenge, and hospital managers and CEOs must be so frustrated that they have to face this challenge every year. Because from what I understand, having spoke to quite a few hospital managers and CEOs of hospital trusts, is that what's happened for the last few years is in about autumn time, they apply for extra funding to deal with what will be a winter crisis. By about November, they hear whether they will receive it and how much they'll get. And then they receive the money by about January, when we're already halfway through the winter, despite the fact that winter comes every year, and we know that there will be a winter strain on the NHS. So in the spirit of being a constructive opposition, I'm going to talk about 4 issues that we should probably consider when we're considering future winter challenges. So the first one, as has been mentioned by nearly everyone who spoke, is social care. That we know certainly in Winchester, that in the Hampshire Hospitals Foundation Trust, there are between 160 and 200 people at any given time who are well enough to go home, but they don't have anywhere to go, often because of the lack of social care packages. And we've talked about the flow through hospitals. This means that people are in a bed, that A&E can't take patients into the hospital because those beds are occupied. It means ambulances end up queuing outside a hospital, and the knock-on effect is there is a huge delay in ambulance response times. And my honourable friend from Chichester mentioned that 1 in 4 people now worry about calling an ambulance over the winter time because they're worried that it would be such a long time until it arrives. The frustrating thing about this is that it is actually more cost-effective to provide social care packages than it is to keep someone in a hospital bed. So, although it's not good for patients, it's not even cost-effective for the taxpayer to not have social care packages in place so that people can be moved out of hospital in a timely way. Primary care is something that nearly every speaker has brought up as well. When we look at everything from doctors to dentists to mental health to public health, a typical A&E department, 22% of the people who arrive there are there because they can't get a GP appointment. You've got people turning up with tooth root abscesses, and they often end up needing a general anaesthetic to sort out dental problems that could have been avoided had they been able to get an NHS dentist. The huge amount of time and resources mental health patients take up when they're walking into an A&E department, desperate, often already on a waiting list. It can take up to 30% of an A&E department's time and resources. And when people are waiting years from being referred by their GP for mental health care and then ending up in A&E, taking up time and resources during the winter crisis, that's not a good use of either taxpayers' money, and it's not good for the patients, and it's hugely stressful for the staff as well. But we also know that it is always more cost-effective to keep people healthy in their community and treat them early rather than treat them in an A&E department. And it's not the place for people who are in a mental health crisis, who have got very severe dental issues, or people who just can't get a GP appointment. my friend from North Shropshire brought up vaccination. As we talk about public health, we talk about prevention, and we talk about cost effectiveness. Vaccines are the single most cost-effective health intervention that has ever been developed throughout the world for pretty much any disease. And it is really concerning to hear that some NHS staff, that the number of NHS staff that were vaccinated is dropping, because it's dangerous for their health, it's dangerous for patients' health, and we should be certainly looking and unpicking and trying to explore why the uptake of NHS staff taking the flu vaccine has gone down, because we need to engage with them to give them the confidence and even the access to these vaccines to make sure we've got this higher vaccination rate as possible, but also within our communities. My friend from North Shropshire touched as well on, we've got flu vaccines, COVID vaccines, RSV. This is always worse in winter. We know it's going to be worse in winter, and we know that the risk of immunocompromised people turning up to a hospital, waiting in an A&E department, and then being surrounded maybe by other patients who are infectious because they haven't managed to get a vaccine is a huge issue. And my friend from Northern Ireland talked about pharmacies, he talked about community care. That is a huge part of the jigsaw when it comes to making vaccinations available to the general public. Local pharmacies need all the support that we can give them to ensure that they're open at convenient times, that they stay open, because a lot of pharmacies have closed, and that people ideally are within very close distance to a pharmacy so that especially vulnerable people can get the vaccinations that they need. And finally, I think every other Liberal Democrat who spoke talked about the Liberal Democrat Winter Task Force and how we'd really appreciate the government looking into these proposals very seriously, because we're spending this money in bit pieces every winter anyway, and to have a much more joined-up long-term plan on how we deliver healthcare over the winter and ease the pressure on hospitals would be hugely beneficial. Finally, I just want to pay tribute to the NHS staff. I imagine that they actually dread winter coming up as well. It's this will be the time of year they'll be bracing themselves, knowing they're going to be busier, knowing they're working without the right resources, knowing that some of them will get sick for flu and COVID and all the other diseases that come in, and we thank them for putting their own health and their own time and effort and expertise to look after our health, and just acknowledge as the mental health spokesperson what a drain it must be on their mental health as well to work in these situations. I suppose the final point is just to ask the government. We know winter will come every year. It will come next year as well. What are we doing to make sure we don't have a planned crisis in the NHS next winter? Thank you.
Thank you, Sir Roger. It is a privilege to serve under your chairmanship, and I thank the honourable member for North Shropshire for bringing this debate on what is an important day. I'd also, as the honourable member just finished, I'd actually like to start by paying tribute to the NHS staff who are dealing with significant demands in urgent and emergency care, which are particularly acute in a post-pandemic world. In the time that I have, I want to press the government on actions it is taking to increase vaccination uptake and make use of available private sector capacity. Vaccination was a key to protecting the population from COVID-19 and ensuring that the virus could be managed and contained like other respiratory illnesses. And delivering on this successful vaccination programme was one of the many benefits of leaving the European Union, and it was a cause championed by the previous government. We must continue the push to protect the most clinically vulnerable and reduce hospital admissions from RSV, from flu and from COVID-19. And I welcome the national RSV vaccine programme launched earlier this summer, and I'd welcome an update from the Minister on the uptake among eligible groups. However, I'm also concerned by recent data which shows the uptake for the flu and COVID-19 vaccine among eligible groups is lower compared to the same time last year. Figures for uptake of the flu vaccine in the week commencing 20th of October 2024 showed that 48.2% in all those aged 65 years and over, that it was 48.2% in all those aged 65 years and over. That is lower than in 2023 to 2024 at the same time. It's a worse picture for those aged 65 years in the clinical risk group. Only 20.8% had been vaccinated, against a worse uptake compared to 2023 to 2024 at the same time. Considering these worrying figures, what actions will the government and the NHS be taking to promote vaccinations to eligible groups, particularly those at greater clinical risk? As other honourable members have stated, many NHS hospitals and secondary care settings are working at close to full capacity. And for this reason, we must maximise the use of private sector hospitals and other facilities to reduce the pressure on the National Health Service. The Telegraph recently reported that private health providers have written to the Chancellor and the Health Secretary to propose a major expansion in the use of private sector facilities and staff for NHS treatment. It was stated that the private sector investment could help build diagnostic capacity, develop new surgery units and intensive care facilities. And if I'm not mistaken, I think the Health Secretary has spoken about the use of private sector facilities. So will the government support these proposals, which would see an extra 2.5 million patients treated in private hospitals and the potential to significantly cut NHS waiting lists? As we're talking about waiting lists in the winter, I'd also just like to turn to the winter fuel allowance, which is being cut, and what assessment the government has on the impact and pressure on hospitals from the withdrawal of this allowance. I believe the Labour Party put out an analysis back in 2017 that 4,000 people would be at risk of death from this. Would the Minister be able to clarify if that analysis is still correct and what the current thinking is in the Health Department in response to the withdrawal of the winter fuel allowance? During the winter months, protecting bed space for elective treatment is particularly important to keeping waiting lists down. This is why we must also build on the capacity provided by community diagnostic centres and surgical hubs in recent years. The last government invested £2.3 billion worth of investment to establish community diagnostic centres, CDCs, which represented the largest cash investment in MRI and CT scanning capacity in the history of the National Health Service. In addition, the Independent Health Foundation has highlighted the positive impact that surgical hubs have made in reducing waiting lists and increasing bed capacity. So despite their impact, Lord Darcy's report on NHS performance made no reference to the role of CDCs and surgical hubs in helping to reduce waiting lists. And expanding the network of surgical hubs with the budget taking place in the main chamber will be helpful to get some clarity on where the additional funding will be spent, and will the Secretary of State or the Minister commit to having more surgical hubs so that more patients across the country can access elective care quicker? Will the Minister also commit to expanding the network of CDCs, which have delivered over 7 million tests already, 7 million tests, scans and checks since 2021? The last government also supported National Health Service Trust to increase elective activity after the pandemic, particularly through the Elective Recovery Fund, which reimbursed trusts for the operations they delivered. However, earlier this month, the Health Service Journal reported that ministers were considering whether to pause or cap the Elective Recovery Fund. At the election, the government minister stood on a manifesto that pledged to reduce waiting times for elective care, such as on hip and knee replacements, to 18 weeks by the end of the Parliament. Pausing or capping the Elective Recovery Fund will surely affect the government's pledge to cutting waiting times and risk placing further pressures on National Health Service finances. I'm sure NHS leaders would greatly appreciate the Minister providing clarity on this point. So can she rule out the Elective Recovery Fund being capped or paused this year? And finally, Mr Chairman, I'd like to just, as has already been said, I'd like to just finish by encouraging anyone who is eligible to absolutely make sure that they go and get vaccinated in advance of this winter. Thank you.
Thank you, Sir Roger, and it's a pleasure to serve under your chairmanship. And I'd like to thank the Honourable Member for North Shropshire for securing this debate and thank members for taking part. Now, we've all just rushed from the chamber, and I think I'm the only person here that's come out perhaps enthused and excited about what we've heard in the chamber, about the massive support particularly for the NHS. A budget delivered after 14 years, the first Labour budget after both the coalition and the Tory party being in power, and one that has absolutely laid the foundations for fixing our economy. And just in case people didn't clock all the figures, 22.6 billion day-to-day extra spending on health budget, including 3.1 billion increase in the capital budget, £1 billion of which helps address those backlogs of repairs that have been allowed to fester over the last 14 years, plus 1.5 billion additional for beds, new capacity for diagnostic tests, surgical hubs and diagnostic centres, just to address the honourable gentleman opposite's key point. So let's take some of that and let's take that point about not just stopping the decline, but fixing the foundations and setting us on the path for the next 10 years that we have been so clear to articulate in only the last few weeks that we have been in government. And I know when I speak to my constituents in Bristol South, the thing that they are most concerned about is also that the NHS spends every penny of taxpayers' money wisely, properly, where it needs to be focused. And that's why we've concentrated on our 3 shifts. That's why we've launched this national conversation, and I hope everyone takes part. Because we all know the problems, and that's what Lord Darcy helped us address. And we also know that winter is a difficult time for our health and care system. And although we can't predict the severity of the weather, we can predict much of the activity. We do know what's likely to hit us most of the time, and we can certainly plan better. Now, I remember working on this issue as an NHS manager back in the day, working across primary, community, secondary care, as well as with ambulance services and local authorities. It's a systems response that's needed, and it's important that we're all involved in preparing and planning. Now, I also remember the early 2000s, just how demoralising it was for staff coming into work every day, fighting fires and sorting out the awful trolley waits, not to mention how unacceptable that is for patients and families. And a point was well made by the Honourable Member for Winchester about the impact on members of staff's mental health and morale. We know that. And I also saw and was proud to be part of the changes we made under that last Labour government to end those trolley waits, and we will do that again. That's what Lord Darcy's report shone a searing spotlight on, including the chronic lack of capital investment that has put many hospitals into a perpetual bed crisis, particularly during peak periods like winter cold snaps. But while we've inherited a broken NHS, it is not beaten, and as we have just heard from the Chancellor, this government has taken the first steps to fixing the annual crisis with that new capital investment. But one budget cannot undo the last 14 years of failure. So while we fix the foundations, we're also mitigating the immediate risks. At the very least, going into this winter, we will be better prepared than we were last winter, because the managers in the NHS will be preparing for winter rather than planning for strikes, which is what they had to do in the last 3 years. That's already a significant improvement. But the Health Service does face challenges on all fronts, and the figures are really sobering. We've heard some of them today. In September, provisional statistics showed almost 1 in 10 A&E patients waited over 12 hours to be admitted, transferred or discharged. The mean Category 2 response time in September stood at about 36 minutes, which is about double the NHS constitutional standard. Now, I recently attended a meeting where officials highlighted the number of attendances requiring admissions are already up by 1.8% in September compared to the year before, which is continuing to take place and increase pressure on patient flow. These are the results of deep structural issues in the NHS that will not be fixed overnight, but work is already underway to rebuild resilience and manage pressures across the health and care system this winter. Now, I'm going to come on to that specific work being done in a moment, but I do want to assure that honourable members here know that the government is taking this issue extremely seriously. I am already meeting senior leaders in the NHS England and the UK Health and Security Agency every 2 weeks to ensure that the risks can be identified quickly and that pressures are managed effectively. And once the peak winter period hits, these meetings will move to weekly, including the Secretary of State. Now, of course, local NHS systems are best placed to determine how to respond to issues in their local area. And that is why NHS England has worked with local systems to ensure robust winter plans are in place at a local level. And as someone who knows exactly what's involved in all that planning, I really also want to pay tribute to the staff for their skill, motivation and commitment to protecting every patient this winter. I will.
Sir, there's nobody churlish in the side of the chamber when it comes to the money that the government has committed to the NHS. We all welcome that. Anybody that doesn't would be insane. We just asked this question. I asked, and trying to be constructive always, Sir Roger, and my contributions. I'd asked about the staffing, and I'd made the suggestion that for those students to retain them here and whenever they do their student training and they come to the end and then they go somewhere like Australia or New Zealand to get a job. Instead of that happening, if government was to consider a bursary type system to retain the staff, I think if we were able to retain the staff, then we'll be able to help address some of the pressures that are here every winter.
I will come on to staffing further on in my speech to address some of those points, because the Honourable Gentleman makes an excellent point about staff recruitment and retention, which is a key part of our future look at the system. Now, in terms of winter planning, the government should not be micromanaging these people in local systems as they do their job. Rather, we need to focus our efforts on where it's needed the most. Now, notwithstanding the excellent work of individual staff, let me repeat, the NHS is broken, but none of us should underestimate how difficult this winter should be, and we also take immediate steps to cushion the blow. First of all, we have set out our national winter planning priorities to NHS systems, local authorities and social care providers to support Operation Resilience over the coming months. Secondly, we are standing up the winter operating function 7 days a week to respond to pressures in real time. Thirdly, we're expanding the Operation Pressures Escalations framework to give us a clearer picture of what's happening on the ground in all our systems. This uses comprehensive data to keep track of hospital pressures, and this year we're expanding the scope of the framework to mental health, community care and 111. Fourthly, we're continuing to support systems that are struggling the most through the Urgent and Emergency Care Tiering programme. These are direct interventions to help systems get back on their feet and make the necessary improvements in performance. Fifth, we're providing targeted clinically led support to 19 of the most pressured hospital sites across the country to help reduce those long waits in A&E and avoidable admissions over winter. All this is in addition to the aforementioned meetings I hold with NHS England and UK HSA every fortnight. I'm chairing every one of these meetings to ensure that we identify risks as soon as they rise, while ensuring that supporting NHS England to mitigate them. Now, I know the Honourable Member for North Shropshire's party has called for the government to set up a winter task force to prepare for an NHS winter crisis. Now, some might call what I've described and what we're doing as a task force. I actually think that is my job, and it is the Secretary of State's job. And as I've already outlined, that's why we meet regularly with NHSE. But I do know that the Honourable Lady and others are sincere in their efforts to be constructive, and I'm happy to take away any specific suggestions that we're not doing to help the NHS, because we all want the system to work well. If I may, Sir Roger.
There was no mention in that about social care packages and increasing social care packages. And when I spoke to the CEO of Hampshire Hospitals Trust today, which runs Winchester Hospital, she said the single biggest thing that would make a difference over winter for the hospital of Winchester and probably every other hospital in the country would be increasing the number of social care packages and ensuring that those well enough to leave hospital can be treated and cared for elsewhere. Why is this not the main focus of the winter sort of, measures that you're talking about?
Thank you. I'm going to come on to social care later in my speech, but if I just make the broader point that every system is different, and actually the pressures in every system are different. Some systems, suffer worse from perhaps poorer levels of primary care or community care. Other systems struggle, particularly across borders, with discharges and those packages of care. So one of the things that we are doing, and I'm very keen to do, is understand the different drivers of the performance in different parts of the system, and I think we all have a role to play in that, and I very much support constructive advice from local members of Parliament in consultation with their local trusts about what the real drivers are in their systems, because we also know that some systems are performing much better, and that is something that we absolutely want to address as a new government, to make sure that taxpayers' money is being directed to the best place to make the system work better. So I think that's something for him to take back partly, but I think the flow is affected by different reasons in different parts of the system. One thing I think is very clear and has been mentioned today by several honourable members is about vaccinations. Now, a key part of winter planning is the annual vaccination campaign, which began on the 3rd of October. And I thank honourable members for mentioning that, and the honourable member for North Norfolk and Winchester, and the spokesperson for the opposition also mentioned their support for vaccination programmes, and I think that is absolutely welcome. Now, as my understanding, people talk about verifying the figures, but my understanding, and I'm happy to be corrected, is that we can't verify the actual figures now. We've started different vaccination rates at different times, so the figures aren't directly comparable. We won't really know that until the year works through, and I think people understand that. It is too early in the vaccination season to draw firm conclusions, but we all have a role to play in driving and encouraging people to uptake vaccinations. And across the piece, and I visited a local hospital in my city of Bristol recently, they are having sort of staff hubs and encouraging staff to go into those clinics. So I think all members' efforts to help do that is really helpful, because vaccination programs play an essential role in protecting the elderly, in particular children, and the clinically vulnerable for serious illness during the winter months, and relieving pressures on hospitals and the wider system. Data from the UK Health Security Agency shows that last year people who received a COVID vaccine were around 45% less likely to be admitted to hospital compared to those who did not receive one. And that's why we are delivering our usual campaigns for COVID and flu for the clinically vulnerable, in addition to the RSV work that's going on as well. Now, with regards to elective activity, for those patients who are referred to a hospital, we want to do everything we can to bring down waiting lists, which stood at over 7.5 million in August. The NHS is prioritising patient safety, urgent and cancer care, and will continue to do its best to maintain appointments and elective procedures by separating elective care facilities and diagnostics wherever possible. And in the longer term, we are going to return to 92% of patients waiting no longer than 18 weeks from referral to treatment within our first term, a standard which has not been met consistently for patients for a decade. Now, on social care, Sir Roger, our hospitals do not operate in isolation, and improving resilience across the whole system, including social care, is essential to winter planning. On the 17th of September, we wrote to all local authorities setting out our priorities for improving resilience across social care ahead of winter, emphasising the importance of close partnerships and joint planning between the NHS and local authorities. We want people to have fair access to locally delivered services that start at home and support them to live independently for as long as possible. And this will include building bridges between the NHS and social care services, getting people home from hospital as soon as they're ready, and providing much needed support to families and friends who are involved in their loved ones' care. We will also work to ensure people are not stuck in hospital beds when they're well enough to go home. And we cannot forget the backbone of social care, our carers. We have been clear to all local health and care systems that they must continue to support people providing care for their family and friends throughout the winter. And I'm sure all honourable members will join me in the support for the Chancellor's announcement today to support our carers more widely as part of this budget. We want to make sure that carers can access the support they need to look after their own health and well-being, not just that of the people they care for. The Better Care Fund includes funding that can be used for short breaks and respite services for carers. The government is clear that people who draw on care and support and their families and carers should be closely involved in decisions about their care. However, in the long term, we clearly need reform. And that's why the Secretary of State has called for a new national consensus on social care. The government is committed to building a national care service. And my honourable friend, the member for Aberafan and Maesteg, is bringing forward the first ever fair pay agreement for care workers. And again, we've seen today about our commitment to further support carers in terms of those improvements to carers' allowance. That's a start, and we know we have a long way to go. So, Roger, with regard to our 10-year plan, we are working radically to reform the NHS through the 10-year plan, building a health service that is fit for the future and ready to face every winter confidently. Lord Darsley gave us the diagnosis, and the cure can be found in shifting the NHS from treatment to prevention, hospital to home, and analogue to digital. That's why last week we launched an extensive engagement exercise with the public, staff and stakeholders to inform that plan. And I'm sure some honourable and right honourable members might be keen to see some of the public's more wilder ideas, perhaps. But alongside some of those, we've already had many considered and thoughtful responses, and we look forward to outlining our specific plans in the spring. With regard to the Honourable Member for Strangford's point about individual training and bursaries and the very large number of suggestions that come forward for the important issue of retaining and recruiting our staff, we will be looking closely at the long-term workforce plan. We're already doing that. We are open to all those suggestions. We do need to build a workforce for the future that lines up with our 3 shifts. That's going to be a tough process to get that right and to keep up with modern technology, but all of those ideas will inform that. So, Sir Roger, if I may conclude, I'd like to commend the Honourable Lady for securing the debate today and to colleagues for shining a spotlight on the difficulties that all our constituents are facing. I hope colleagues are somewhat reassured that as someone who has worked as part of winter planning in the NHS, I am fully aware of the challenges we face, and that's why we've taken a strong grip of it from the get-go. I know we can't go on as we've done for the past 14 years, limping from one winter crisis to the next, improvising and making do with sticking plasters. The government is winter-proofing the NHS with long-term reform, but until that day, we will put every hand on deck to tackle the problems as they arise this winter. Thank you.
Helen Morgan to wind up the debate.
Thank you very much, Sir Roger. I want to thank you and the Minister and the Shadow Minister and all my Liberal Democrat colleagues and the Honourable Member for Strangford for coming along to this debate on what is a very, very busy day. I'm grateful for all of their contributions, which have, as always, been positive and constructive. Particularly thank the Minister for a comprehensive response, and it's reassuring to hear that she's got considerable expertise in this area. I just want to say that coming out of the budget debate, obviously we welcome a significant investment in day-to-day NHS spending, in capital investment, and in dealing with the repairs backlog that needs urgent attention as well. We've been calling for that as part of our general election campaign, and we recognise its importance. But by the very nature of the budget statement, we have been a little bit light on detail today, and that's why we want to provide the constructive opposition and the constructive ideas to move this forward. I would like to just reiterate my concerns around social care, because so little was said today, and because we know that so many social care providers are small businesses who will be heavily impacted by not only the increase to the minimum wage, which is welcome for carers, but also the employers' NICs. And we risk a real crisis, I think, in those companies and in those local government budgets, which are so perilously stretched if we don't have a plan to fund how those carers and their wages. So I will leave the Minister with that thought, and thank everybody for attending. Thank you.
Oops. The question is that this House has considered NHS readiness for winter 2024-2025. As many of that opinion say aye. Aye. Contrary, no. Ayes have it. Order. Order. Sitting suspended until 4 p.m.